Hey, hello everybody, and welcome to Hairdresser Power. We have a very special guest today, Dr. Tess Mauricio, America's favorite dermatologist, and also my favorite dermatologist because you actually work on me.
Yeah,
right?
Exactly.
And you were gracious enough to come to our studios today because you see an opportunity to talk to hairdressers about something that's a major concern, that maybe they can do referrals, they can catch it early,
Absolutely.
and that's hair loss, right?
Absolutely. I mean, hair loss affects men and women. As we all age, we see more and more. As women go through menopause, it becomes a big issue. And as you know, hair is so important in our psychological well-being,
Absolutely.
in our confidence, in our self-esteem. And now we have medical advanced technology that can help regrow hair, make our hair as healthy as possible using our own natural ability to heal and regenerate.
Well, you know, people would ask you probably, well, Tess, you're a dermatologist. How does that apply to hair? And how is the transfer? You know, I know obviously there's new techniques. There's really things that are dealing with the skin, which is part of dermatology.
Yes.
And then they say, well, how does that hormones play? Well, obviously acne, other things. It's all hormonal. The skin reflects the hormones, right?
Absolutely. And you know, dermatologists, our expertise is really skin, hair, and nails.
Okay.
And so hair, we get extensive training on hair. And so it is part of what a dermatologist, if you have any hair issues, the dermatologist is really the doctor you should go to. And so it's kind of like an extension of what I do. And as you know, we've talked about the time machine procedure
Absolutely.
before. The use of platelet-rich plasma and the growth factors in platelet-rich plasma is able to regenerate our skin. Mm-hmm. But now what we're seeing, more and more data is coming that we can also use our own growth factors from platelet-rich plasma to regenerate and get our scalp as healthy as possible, and the result of that is more beautiful hair.
Well, let's break it down for the folks because I actually have experienced it, and it's a very simple process, and we could probably walk people through it. It's not that scary, guys. It's really easy. Go ahead and tell them how it works.
It's very easy. So essentially, you come to the clinic, you get a very simple blood draw. We use the tiniest needle, so that part is not even painful at all. And then we separate out the red blood cells from the platelet-rich plasma. We harvest that, and in the platelet-rich plasma, so if you've had a burn and if you got a blister and you popped it and you see that clear fluid, that is the platelet-rich plasma.
Okay, but that's in your blood, right?
It's in our blood, it's circulating. So essentially what we're doing is we're harvesting that part of our blood that contains the growth factors, and we can use that platelet-rich plasma now in many different areas of our body. So if we are rejuvenating the skin, we would use it on the skin. And now, because we are here, we're talking hair, we can inject it in the scalp, and data is showing, and our patients are really experiencing this. They are seeing decrease in loss of, their hair shedding. Also, it's causing the hair to become more healthy. They're able to style their hair better, and it's stopping hair loss.
Well, that's amazing.
It is.
And I know, and that's the first step, but you have even a secret weapon beyond that.
We do. So think of platelet-rich plasma as fertilizer, but what happens when you actually don't have any more active hair follicles?
Yeah, like they're dead supposedly, right?
Exactly.
Okay.
So with hair loss, with male pattern alopecia hair loss, or maybe with alopecia areata, or just as you age, we lose hair. The hair follicles, miniaturize, and then they go away, and then they're not there. Right. Well, we now can harvest our own stem cells from fat. Wow. And transfer stem cells back in areas where we want to grow new cells. And of course, on the scalp, we want to grow new hair follicles. So essentially, we are replanting seeds, and then you now have new hair follicles.
So what you're saying is, theoretically, and probably you've seen it in practice, we're going to talk about that, is that you can actually take stem cells and you harvest it through liposuction? Is that how you do it?
Yes, so it's another simple procedure. It sounds scarier.
I had it done one time for my knee.
Yes.
And that really did, I have a really, bad injury on my knee.
Thank you for sharing that.
Yeah, and you basically, there's a show, and if they want to look at it, they can. It's on the old Healthy Life show. And literally, I had a torn quadriceps and many other things going on, and I'm pretty functional. I'm not 100%, but it really did help, I believe.
Yeah, so essentially, over the last 10 years, we have, found that our fat cells are rich in adult stem cells.
Okay.
And so it's being used in orthopedics, it's being used for joints, for chronic pain, for autoimmune diseases like rheumatoid arthritis. And now the new indications and new applications is in cosmetics and in hair.
In hair.
It's amazing.
So literally, there could be a person that said, you know, previously it was always thought that once a hair follicle is dead or has died, that there's no bringing it back. You're saying there's a chance.
Yes.
Okay.
Correct. So, you know, basically before, if you lose the hair, you say, well, you need a hair transplant,
correct,
right? So you're going to actually move.
And I've done that. I've had a hair transplant
right,
before.
so is my husband.
Right.
So, you know, and it's amazing.
It
right?
is.
It's amazing.
People don't know.
Yeah.
Yeah, it's your own hair. It's like literally your own hair. It grows, you cut it. I mean, it's incredible.
I'm all for it.
I'm all for it. I'm all for maintenance, you know?
I'm all for using today's technology to look and feel good. Why
Absolutely.
not, right?
Absolutely.
And so, but
Stuff's good.
a lot of people, a lot of people don't want, are scared. They don't have, the money to have a hair transplant procedure. But now there is a way where you may not need the hair transplant, or, sometimes hair transplant you're only able to cover certain parts of the scalp, say the front part,
right?
But you're continuing to lose other areas, so you're going to try to save the other areas like the crown area, so that your hair loss is not as progressive.
It's minimalized, in other words.
Exactly.
So basically, tell us what happens. I mean, you go in, right?
So the
because this is the part you Patrick. Oh, it's nothing. Come on in.
It's really nothing.
I'll give you some lumpia. It's good. I was like, okay.
You can go to our website too, and you can see this. But
what is that website for the folks?
It's mbeautyclinic.com. But also you can look at ALMI procedure. So the name of this procedure where I'm harvesting fat for stem cells is ALMI, autologous lipocyte micronized injection, which means it's
not only is she good looking, she's got a huge brain on her. Do you see that coming out of her mouth? I liked it.
Autologous lipocyte micronized injection.
Whoa.
Get that
Hello.
right. ALMI. So almiprocedure.com.
Yeah.
So essentially you come in and it's all done under local anesthesia, which is nice. So you don't have to go under general anesthesia. It's a very safe procedure. And I just numb a little area of fat pocket.
Okay.
And usually everybody has this.
Oh, yeah.
Like the thinnest
You know what I've noticed too? Even when people aren't fat or that they have maybe a lot of fat, one side kind of needs to be balanced, right?
You got it.
Yeah.
So they really appreciate that I can make them symmetric.
Yes.
One hip is usually, or one love handle is usually bigger than the other, and so I grab it from the bigger side. And we don't need a lot. You're talking about 50 to 100 cc's of fat, very little fat. And the harvesting procedure is almost completely painless.
Well, because it's the tickle, right?
No, you can do the tickle if it's a bigger case, but we can actually do it just manually.
Really, just a syringe removal?
Exactly.
Oh, wow.
Closed syringe
That's
harvesting.
Super easy,
Super easy. Maybe takes about 30 minutes of harvesting, and then we process the fat, and then we inject it.
Wow.
That's it.
I wanted to mention one thing to the audience, you guys. If any of you have a question at any time, we have people off site. They'll just send it over to me on this iPad, and we'll be able to answer your questions.
We're on Facebook Live,
loves questions, right, Tess?
So we're on Facebook Live. So if you have any questions right now, Patrick is a wealth of knowledge. I mean, I just had a tour of his facility. Oh my God.
Yeah, it's fun.
It's amazing.
It's fun stuff.
It's
amazing.
Love it.
Yes.
I love it because, it's like Patrick uses only the best technology, right?
Yeah. And most
the
advanced.
best ingredient, most advanced. And that's what I'm about too. It's always seeking for the latest technologies.
Well, I'll be a testimonial to that, because there are oftentimes, I've worked with other people as well, because I've had the Healthy Life Show. A lot of them don't even know about some of the equipment you have. Like, for example, a lot of them are now just getting into Fraxel, lasers and things of that nature. You've had Skinfinity RF for a long time. We mentioned the Time Machine.
Right.
A lot of people don't even know what that is, even people in the industry. So you are ahead of the curve, definitely.
Thank you. And I really pride myself, and I think that definitely my patients benefit from that. I'm able to look ahead. Usually we tell our patients we're about 2 to 5 years, at the minimum 2 years ahead of the curve. It is my job to educate other physicians out there. Actually, in July, I will be at the Aesthetic Show lecturing and giving a whole workshop on ALMI.
Oh, that's wonderful.
To teach them, because there's other indications for the stem cells. So not only can we use it for the scalp, we can use it to turn back the aging on the face, revolumize, apply stem cells. For the joints, you can inject like you were talking about.
Now, you could probably share with the audience some of the success stories you've had. I know you had one with, I think it was rheumatoid arthritis.
Yes.
With a family member, I think it was.
Absolutely. Yeah. So we're talking about regenerative stem cell therapy, which is the procedure that I performed on Patrick, just harvesting a little bit of fat.
Guys, and it was several years ago.
Yeah, I think that was almost 4 years ago.
Yeah, it was. It was wonderful.
And
with the help of your amazing husband, James.
Exactly. Yeah. He's there. And so it's the patient you're talking about is my mom's cousin who had severe rheumatoid arthritis, severe pain, and has tried everything that her rheumatologist has recommended. And just
stopping you for a minute, why this is so important, you guys, is how many of you are hurting? How many of you have been diagnosed with carpal tunnel and arthritis? Because, as hairdressers, we're always bending in funny positions. Totally. Our hands just get so much abuse.
Right.
So oftentimes we experience that as hairdressers.
Oh, absolutely. Your knees, your neck, your back, your hands, just repetitive use.
Yes.
And then you start taking a lot of medications, and medication is no longer working. It's impeding on your ability to work and your ability to enjoy life, normal life. And so she was to a point where she needed her husband's assistance at all times.
She was getting a little depressed emotionally as well, wasn't she?
Absolutely. Yeah. After we treated her and she got better, she confessed to everybody that she was really thinking of, ending her life because she couldn't imagine living life in that much pain, not having any hope for getting better, because medical, her rheumatologists are telling her, we've already have you in everything. We treated her just once, and that was almost 5 years ago.
I think it was the same time that I got my knee.
Was it the same day? It might have been the same day.
Yep.
It might have been the same day.
I'm pretty sure it was.
And it worked, just like Patrick, just like, my dad, we've treated my brother, my husband, father-in-law, many other patients. I
know Peyton, I think it was Peyton Manning that got this therapy in his neck at one point as well. So there's a lot of athletes that are achieving this as well.
It's becoming more and more mainstream, and with Almi, now we're able to harvest fat under local anesthesia. You don't have to go in the OR. You don't have to have a general anesthesia. It's a simple harvest, and then reintroducing it to the body is also simple. And so the hope is really educate other physicians out there that this technology exists, and the general public that if you are having chronic pain.
Yes. Well, remember, as hairdressers, we're touching people. We find out intimate details about them. We know about their health. We know about these problems. We see the balding occurring before it becomes an issue. So we need to have this kind of knowledge to help our patients as well, or our clients as well.
And I was the first person I thought about with Almi Hair was Patrick, because I know that Patrick reaches out to thousands of hairdressers all over the world, and I wanted to just let everyone out there know that these technologies are available. And I know that as a hairdresser, you want to help your client. You want, and you also experience how depressed they get, how they change their social life, and it affects.
Oh no, I don't want to go out to tonight because they don't feel good about how they're looking and they're losing their hair, and there's alternatives, and that's why I wanted you to come on to share with hairdressers.
No,
this is part of hairdresser power. It really is.
Right, because if we can work together, if hairdressers and the medical doctors who perform these procedures can work together, now you have more hair, you have healthier hair to style.
Absolutely.
The result is going to be better for you. Your patient's going to be happier. It's a win-win for everybody.
And honestly, hairdressers have such good hearts. They just want to help their clients. Bottom line, and this is an alternative for them.
Right.
So now we have some pictures today. So we're going to talk about those, and a lot of it is towards the hair loss. These pictures we're going to show today. So let's throw up the first picture. Okay, here you go. Here's an example of.
So this is I would say, right, in their 40s. And this is before, and this is 6 months after his Almi hair procedure.
And the Almi was the one where you actually harvest the fat.
Right. Okay. Harvest the fat and get the stem cells, and then transfer the stem cells in the scalp, and then also mix it in with the platelet-rich plasma.
Okay.
And so we are using his own stem cells. There's no hair transplant that was done here.
That is amazing.
That is amazing. And obviously results vary.
Right.
But this just gives you an idea that it is possible, because if you take a guy in the before and you don't interfere, Patrick.
Oh yeah.
It's just going to get worse.
It will.
Hair loss is progressive.
Absolutely.
It's just going to get worse, and it's going to continue to affect his self-esteem.
Absolutely.
He's going to look older. He's going to feel older. I mean, I'm just telling you from my husband who's had hair transplant. He's so different.
Yeah, he looks like he's about 12 years old.
Yeah.
But,
yeah, I better stop
except I saw some grays, and I'm feeling better.
Yeah, that's true.
I feel better right now. He's
His
human.
hair still turns gray. That's
right.
your job.
I know. Well, I got
That's
some
your
for that.
job,
Yeah,
right? Exactly. So I can grow the hair, and you had to
That's
color
right.
the
Well,
hair.
that's what stylists do.
Exactly.
You know, the number one thing is, I know, you talk about facelifts, and that's really invasive, right?
Right.
That's where you come up with a time machine. Well, here's something that the hairdressers have. When you color someone's hair, they look up to 20 years younger. A facelift only makes you look on an average 10 years younger.
I'm a huge believer in coloring your hair.
Absolutely, guys.
I don't understand why people want gray. I don't get it.
Hey, my hair's so short that that's all I have right here.
I mean,
I
I'm
don't color my
looking.
hair
I'm
anymore.
like, I think about 40%. 30 to 40% of my
it
hair is gray. I'm 46 this year. It happens.
I know,
it's
right?
part of life.
I'm okay with it.
But it's okay because
why
there's a solution.
age gracefully if you don't have to? It's called maintenance. If your house is peeling and the paint's peeling off, what? So you're not going to paint your house, right?
People take care of their cars better than they take care of themselves.
Oh, I would say so. Absolutely.
Why? I mean, and we have to really appreciate and talk about the way we look really affects the way we feel and the way people,
perceive us.
And deal with us and treat us and all of that. And it is what it is. It may not be fair, it may not be right, but it is the way it is. And I have patients coming into the clinic and I just do a little Botox and they're walking out and they're like, I feel 5 years younger already, and it hasn't even worked.
Right.
It's just
you did something for yourself.
Exactly.
And that's a big part of it.
That's it. And this patient, you can just imagine how much his life is better.
Well, I know also that people that do, in fact, have hair transplants, this helps with the transplantation process to maintain them.
Exactly. There are doctors that during the hair transplantation procedure, they will inject platelet-rich plasma, PRP,
yes.
Because they feel that the success and the viability of the grafts get better with platelet-rich plasma. And then also, again, if this patient got hair transplant, it's really usually just the front that gets covered with, 2,000 to 3,000 grafts.
Right, depending on the individual, right.
But that part, the crown area, you can't possibly fill all of that with a hair transplant.
I know.
You probably need multiple visits,
yes.
a lot of money.
And you gotta have a really good donor area.
That's it too. Yeah. So now we have ways to maintain maybe certain areas that have not been transplanted. You're hoping you will not need a transplant.
Right.
If you're lacking in the donor site, you may have another option as well.
There you go. Well, this is great information. And this is like the latest, greatest information.
Cutting edge. Most doctors, you guys are ahead.
Absolutely.
Most doctors are not even aware of this technology.
No, they aren't.
Platelet-rich plasma for hair loss. At the American Academy of Dermatology meeting just this year, one of their hot topics is platelet-rich plasma for hair, and we've been doing this for our patients for a while now. And I'm sure that in 2 years they'll talk about fat and stem cells for hair loss.
Because they're about 2 years behind. But that's okay.
Just how it is.
Because you're on the cutting edge, and you're here today to share with hairdressers.
That's right. I want people to know there's hope.
Well, let's look at the next picture, guys. Okay, tell me what's going on here. Is this the same guy, or?
It's a different guy.
Okay.
Very common, right? The receding hairline, and then you start trying to fix your hair.
That's what happened to me.
Style.
That's what happened to me. It started going back right here.
Mm-hmm. And even women.
Yes.
Okay, you may see some celebrities who love to pull their hair back tight, and they're starting to have receding, hairlines like that. And it is devastating for women. I mean, it's devastating for men, but for women,
more so for women,
because men can shave their hair, look really cool, but
or a hat,
or a hat. It's not an option for women, and it limits the hairstyle. And that's very frustrating for women. And so he also had the ALMI Almi hair, hair treatment, again with using his own fat for stem cells and combined with platelet-rich plasma.
That's awesome. Great results. And that's no transplantation on this one.
No transplantation.
And what was the time frame on that, Tess?
You're looking at least 6 months out because hair takes, there's a hair cycle.
Yeah, 3 cycles.
And just like if you've had a hair transplant, it usually starts seeing it at about 6 months, but it gets better up to a year.
Absolutely.
Or so.
Absolutely. Full results aren't realized till over a year. Yeah, absolutely.
Exactly.
Okay, good. So same kind of thing. I think we have we do have a question. Let me grab this.
Cool.
Okay.
Send your questions in. We'd love to answer questions. Are there any questions there?
Okay. I don't know. I didn't answer this question.
Oh, really?
There it is. No, it's cool.
Patrick looks scared.
Name the most important products, not brands, in your opinion, that belong in every 20 to 40-year-old's skincare routine. Wow, that's a kind of a big one, isn't it?
Sure. So the kind of products, number one
like a moisturizer
is number one is sunscreen. Number one is sunscreen.
Tell me about SPF. Tell me about SPF.
Right. So SPF is a measure of the UVA and UVB, usually UVB, ultraviolet B. But now there's new data that says that even visible light is important if you have issues with discoloration. And so if you have discoloration, you want to make sure you have visible light coverage. SPF, the higher sun protective factor, the higher it is,
in other words,
the better. And essentially, the thicker the layer that you use, the better. And also, there's no such thing as a completely waterproof sunscreen, so you have to reapply. So sunscreen is important. Moisturizer is important. Even if you have acne-prone skin, you have to find a moisturizer, because sometimes when you're over drying it, 24-year-old, you might be. Yes. So you want to do that. You want to have a nice cleanser. And if you have acne-prone skin, you want to find a cleanser that may have maybe glycolic acid, salicylic acid, that kind of thing. But, as a dermatologist, sunscreen and sun protection is very important.
And the other thing was, they said, what about people that apply makeup? What is your thought on applying sunscreen with a makeup? Or
absolutely. So if you can find makeup that has sunscreen, layer them. So layer your protection. So you want sunscreen first, right? And then you put your makeup on. And if your makeup has sunscreen, that's great. We also now have oral sunscreen that we call oral sunscreen with antioxidant. I formulated Helio Plus. It has the...
They can find out about that on your website, right?
Yes, so you can add that on. So the more layers of sun protection you have, the better.
Okay, and that's an oral thing that you take, and then it gives you protection just when you're out in the sun, because it's in your body, right?
Exactly, and it's waterproof, it's full body protection.
I like it. Okay. Cool. More questions. What are your thoughts on hair restoration thinning preventative brands? Like they said, Keratinique and Nioxin. I mean, if you don't want
what is your opinion? Because you're the product guy.
Well, I mean, honestly, I used to work for Nioxin, and I've been with many hair care brands, and I think there are certain cases where they do help, but you're going to probably know if you're going to get any results of those type of products within about 2 months. And if it doesn't happen, then it might not happen after that point.
Okay.
And the other thing is, once you use any brand, whether it's Rogaine, minoxidil, anything of that nature, you still have to use it continually.
Totally, so that is correct.
Yeah, but that was
people always ask me, when can I stop? When you don't care anymore.
Right, exactly. So even though you get a hair transplant, you may still have the genetic tendency to lose your hair. So yes, the new ones that came in probably are never going to fall out because they came from here. But the ones around it may. So you still have to do a preventative type of procedure.
Right, and that's where, your doctor, if you got a hair transplant, probably talk to you about Propecia and Rogaine and your supplements and the products. And so PRP, platelet-rich plasma, and Almi hair treatment can really add, you can add that to your potential maintenance.
It's a lifelong process that you guys are going to have to deal with, unfortunately. So, hopefully the genetics are not so bad, and this is your pattern area, and that's it, and you dealt with it. But if not, it's still a battle.
Exactly, and not just for men, but for women. I've obviously in my practice, the majority of my patients are women, and especially when they hit menopause, that hormonal change, it causes a lot of hair shedding, hair thinning, the hair becomes brittle, and then with gray hairs comes a lot of hair coloring, and so the hair becomes damaged too. So that changes the quality of the hair. So
that's why you need a good pH balanced shampoo and conditioner to counteract that, which is important.
Totally, because the same thing, you're going to be coloring your hair for the rest of your life unless you want a head of gray hair.
Okay, here's an unrelated question, but it's okay because she's a dermatologist, guys. What is your opinion on lip injections for enhancement, and what type of product do you recommend for that? So, I mean. All
right, so lip enhancement, I think if it will make you feel better, go for it. And but I'm all about looking natural. Okay, so I actually have some lip fillers because naturally I don't have, my upper lip is so thin.
Well, you know how this is the thing I think people are informed on, is they have these silicone parties where they inject silicone in their lips and crazy stuff.
Right.
That's a no-no, right?
Yes, so you have to be careful with permanent fillers, especially in the lips, because the lips are notorious in forming what we call granuloma, and those are the bumps and lumps that if you have a permanent product like silicone, you cannot get rid of them. You have to cut them out.
It's literally surgery.
Yes.
At that point.
So I prefer what we call hyaluronic acid fillers like Juvederm, Volbella, Restylane. Those are products that are naturally occurring in our lips. And find a good doctor. And for me, as long as it makes you feel better, but I'm about looking natural. I really think that if your lips are too big, it is distracting and it takes away from your authentic beauty. But it can add to your authentic beauty if you need it.
Then another question was, based on fillers on the face, we don't want to get that lion look, the lion look or whatever. I guess you look like a cat. So can you talk about that a little?
Sure. Okay, so I think that a lot of doctors are overfilling the cheeks.
I think so.
I think that is happening. It scares a lot of people into thinking that if I start having fillers, I'm going to look that way. I tell people it's really based on your doctor's expertise and their artistic eye, sort of like a hairstylist.
I agree.
Right? You could be using the same scissors, but an amazing artist can create beautiful results, and a hat can.
Well, you know what? You can give your 3-year-old a pair of scissors and let him go to town, right?
Same there you go. Thing. So it's not about the tool; it's really the artistry. And so you can go to a doctor, find a doctor that is all about, really just enhancing your natural beauty, reversing the aging process, and just, allowing your beauty, authentic beauty, to shine through and not change the way you look.
I agree. And oftentimes we've seen celebrities, we know some of them right off the top of our heads, or people that we've known that have got the quote-unquote facelift, and they don't even look like themselves any longer.
And it can end their careers.
It can.
Because fans like the way their idols look.
Right.
They just don't want them to look old.
Right, exactly.
But it's possible now. We know that we have ways, and we have amazing medical technology and expertise. When we combine them, we really can reverse and stop the aging process.
And I know, we won't name names, but I know you've had the opportunity to work on many celebrities now, and I've known a lot of those celebrities. In fact, I've brought some to you at times. And I'll tell you, they are just an improved version of themselves. And that's the key. They look the same, but you go, wow, you look younger, you look different. Their eyebrows lift, right? Without surgery.
That's it. We can lift the eyebrows, we can open your eyes, we can remove eye bags, we can help with drooping without surgery. And when you walk in the room, people will just say, you look amazing, you look young, but they will never know what you've done.
Yeah, that's a sign of good work. Exactly. Okay. Well, we have another question. You're getting a lot of questions today, Tess. Now that social media is such a huge part of our lives, can you share some success that you've had using social media in your practice? Well, not only does Tess use social media, she also uses media heavily, including your own television show, appearances, and all these other things.
Yes. I think that, we are at an amazing time where if you have a message, if you want to educate, if you want to empower and inspire people, we have a platform available for all of us. It's no longer just, you know, the mega stars.
Right.
I think, the YouTube and Facebook Live, it's so amazing that we're able to instantaneously communicate our message. And it can be used for good or bad.
Oh, yeah,
right?
absolutely.
And so hopefully, you know, those who watch us, you know, my husband and I, James and I, do our Soul to Skin MD Talks, which is, you know, inspirational talks. We talk about mind, body, and soul, using our medical expertise combined with what we've learned about, you know, tricks to how to live life with happiness and joyfulness. And then, you know, like this show, right, talking about the latest technologies to improve our lives so that we can all live the best lives. And so that's kind of, I believe in the power of media, and now more than ever we have the tools to really spread inspiration and empower, you know, everyone around the world.
Great answer. I love it.
Thank you.
All right, let's look at the next photo, if we could, please. Okay, here you go. What's going on here?
Well, you know, you have to practice what you preach, right? I believe in that as well, you know, and this is my husband, Dr. James, and me treating him. This is, as I told you, my husband has had a hair transplant, so the front of his hair, that's transplanted hair, but the crown hasn't been, and it was starting to really thin out too. And so we treated him with the platelet-rich plasma. Again, this is the one that is simple.
Right.
We just come in, it's a quick blood draw, we spin out the red blood cells, collect platelet-rich plasma, use a cooling machine. There's that.
Yeah, and that's the one you use when you do the laser work. Okay.
So it cools, it distracts you, it's very quick, and you're good to go.
Yeah, I tried it the other day when I was getting the thing, and it was great. You did quite a few injections, right?
Yeah.
And it was not a big deal.
And we didn't numb.
No,
we
not
don't
at all.
need to numb.
No numbing. It was great. I recommend it. I mean, you know, if you're doing another procedure,
totally.
But not a lot of doctors are doing this yet, and we want more of them to do it.
Totally, and it's great for a hairstylist to know that this technology is available. If your clients are complaining, if you're noticing areas of thinning, this is really wonderful for them because it's simple, it's very safe, it's their own growth factors that we're re-injecting.
And the earlier you get to it, the better. And that's where the stylist comes. You almost as a doctor need to team with the stylist so they get the people coming in right. You guys, it's really dependent on when you catch it. They're not going to go to a dermatologist until it's too late. So, okay.
Right. I mean, you know, medicine is like, we're good at treating disease, but, you know, maintenance, it's really for hair. The hairstylists are the ones that pick up, you know,
and they see the changes, yes.
Yep. And all of that.
Okay, very good. Now, do we have another picture? Thanks for that for James. He's smiling while he's getting paint. And there you go. This is cool. Yeah.
This is cool. You come in, we draw your blood, we put it in this special tube, and then it gets centrifuged, and you can kind of see the bottom part is darker. That is the red blood cells, and there's a special separator gel, and then this kind of golden clear fluid, that is the platelet-rich plasma. We draw it up, and then we inject it in the areas of the scalp that's weak, that's thinning, you see the hair that's miniaturizing, and essentially fertilizing with your own growth factors.
Right, so it won't reject anything. There's no rejection there.
There's no rejection. Yep. And this is the same platelet-rich plasma that we inject to rejuvenate the face.
The face.
Yep.
When you do the micropen technique, which I love, which is like a mini tattoo. Yeah, it doesn't hurt at all for me.
Yeah, tiny little needles.
Little needles, and then they put the PRP in, and it creates these little micro wounds, and the PRP just goes right in, and it makes it more effective.
Right, makes it more effective, and it cuts down on the downtime, believe it or not. It's like you're doing microneedling, but you're applying the anti-inflammatory effect of the platelet.
Yeah, mine was a week ago, and I was in 2 days back to normal almost.
You look so good.
Yeah, no, I don't even have a red here anymore. I mean, you remember we were working on that? It's getting better. Because I noticed that when I was on camera, I was seeing these blotchiness. And you said, "Oh yeah, Patrick, you're starting to get older." Yeah, I know,
Patrick,
but it's okay. Yeah, I'm 55, so it's okay.
Yeah, you look amazing.
Yeah,
Patrick,
look
at him.
It's pretty clean.
He's not wearing makeup.
No makeup. I'm a little greasy. I was running around outside.
He was showing me his building. So
no, Tess is taking care of me, and you guys, it makes a huge difference. But the thing is sometimes People never see a dermatologist in their life, and they should, just for skin cancer checks, but they're always going to see their stylist. So this is something that the stylist has to be aware of and tell people, hey, and for the stylists themselves.
Totally.
You guys, there are alternatives to looking younger. It's just as much as people come in to color their hair, they should be doing these techniques as well.
And it's all natural. I think a lot of people get scared when they come in because they think they're going to end up like the Catwoman, or they're going to look, you know, scary or change. Their grandkids won't recognize them, you know, that kind of thing. But it's
this is
really,
the good one like this. Huh?
Who doesn't want to look like a younger version of themselves?
Yeah,
but I mean, like where
some
you
people
were
don't,
good.
but when you were good.
Not too young.
No, not too young.
James,
I think your husband took it a little too far, okay?
Well, I think I like to stay like this. I don't want to go to how I look in high school.
No, you were cute though. I saw your ROTC stuff.
Did you see my hair?
It was cute.
Talk about hair.
It was big. It was good.
Yeah.
It was smooth. Do we have any more pictures, guys? Or is that it for us from the pictures? Oh, that's the last one. And what do we got here?
So there it is.
That's when he's making a special face.
Tiny little needles, you know, these are tiny 30 gauge. So just like what Patrick said, don't be scared. It's nothing. If you're a woman and you pluck your eyebrows, this is less painful than plucking your eyebrows.
It's definitely less painful than waxing down here. Because that's like, not that I do that.
That's what I mean.
I had to try it in beauty school once and I went, okay, you women are tough. I got you.
Women, you know, we understand, you know, no pain, no gain. And so, okay, if you wax, this is less painful than waxing. And having hair that's healthy again, that's full, that you're able to style the way you did when you were younger. I mean, it makes patients happy. And the goal for everything I do is to just increase happiness.
I agree.
It really is.
Well, that's what stylists do. That's the power of being a hairdresser, is to make people more beautiful and make them more confident and enjoy their lives more.
Totally. I was just, today, we were at UCSD with the Dalai Lama. And guess what the Dalai Lama said is the purpose...
Smoke weed. No, just kidding. He didn't say that.
What?
Maybe he did say it. I don't know.
The purpose of life, right? The purpose of life is to be happy. It's about happiness. This is why we're here. And this is why I look for all these amazing new technologies, because they're just tools to help my patients live happy and full lives.
I love it. And I love the fact that the technology that you're pursuing is a more natural type of technology.
That's what's in right now, okay? They're like, facelifts are so 90s or even 80s. 2017, it's all about utilizing our own body's natural ability to heal. We're using platelet-rich plasma, we're using our own fat to harvest our own stem cells. Imagine that. You know, I mean, if you believe in God, I mean, God has really designed our bodies amazing, that we are able to heal and regenerate, and we are now really just barely in the, you know, tapping into it, and what we're seeing is amazing, miraculous.
There's a lot of technology that's been coming in the forefront right now, and we're just on the cutting edge of it, just on the beginning edge of it, I should say. So thanks so much for coming in.
Thank you, Patrick.
Hey, thanks for all the great questions today. I mean, they're pretty good ones today.
Really good.
And you guys, if you want to catch this and you want to subscribe to Health Beauty Life, we recommend that you go to YouTube and go under Hairdresser Power. Excuse me, I said Health Beauty Life. Look at me. I'm thinking about the old days, right?
Well, they can still check out Health Beauty Life because there's so much great content.
We've got a bunch of good shows on YouTube.
There's so much great content on YouTube, but Hairdresser Power, I'm excited. If any of you are have questions, go to mbeautyclinic.com. There's a live chat function. So
and you're on just about every day on social media, right?
And I'm also on Facebook Live. Go to Dr. Tess. Tess Mauricio is my personal Instagram, is at Dr. Tess Mauricio. You can message me. I'd love to hear from you. It's really about, like what Patrick said, partnering with the hairdressers, because you guys really are right there. You know, we share our lives with our hairdressers, right?
Very much so.
Actually, Jigs, who does my hair, was with me with the Dalai Lama.
No way.
See? She's there. Hi, Jigs.
She's on? Yeah, there you go.
Yeah, so thank you, Jigs. She saved the best seat.
Hey, I hope she tries the F18 that I gave her and the bleach and everything. So, you know,
I'm
gonna hook you up, girl. So there you go.
Yes, and she's amazing. So thank you for having me, and thank you for, you know, always educating your, you know, the general public.
Well, it never ends. You know, that's our goal in life, is to make hairdressers have more knowledge and different kinds of knowledge so they have more power. That's why it's called Hairdresser Power.
It is. Knowledge is power.
Absolutely. So follow us, like I say, on your Facebook, your Instagram, and also check out our archives and subscribe to Hairdresser Power on YouTube. Okay, guys? And thanks so much, and we'll see you next time.
Bye.